So, fantastic to be here with you, Dr. Gao, surgeon from NUHS in Singapore. I, in fact, had the pleasure to visit you in your operating theater just a few weeks ago, and impressive to see what you've already achieved with 5G, of course the augmented reality gear, but changing the procedures in real life. So why don't you tell us a little bit about it?
Thanks, Erik. First of all, very happy to be here, and thank you for inviting me to be here. And yeah, so essentially, the 5G setup in NUHS really came about because of our search and our need for better connectivity. Initially, it was mainly for our MR and XR program, but of course now we are aiming to apply it in even more areas and to integrate it more into the hospital system itself. Right, so how we started was because we were using these MR devices, the Microsoft HoloLens 2, in the OR for surgeries. We were converting patients' CT scans, MRI scans into 3D holograms and using it for surgical planning, surgical image guidance. And what we found was that on the old Wi-Fi network, the images were not really very stable because of the poor connectivity. They would jump around, they would move and stuff like that. So that's when we started the search for something better, and that's when we first got into contact with 5G. And bringing in 5G, I think at the start, like I mentioned, it was mainly just to essentially improve the connectivity.
More reliable connectivity.
More reliable.
Replacing
That's
unlicensed,
right.
with
That's
5G.
right, exactly. But I think as we got to understand the technology more, as we knew more about what 5G could actually do, then it really opened our eyes we realized that there's a lot more possibilities and a whole different way of looking at connectivity, looking at data transmission, looking at network implementation in the hospital itself. Right? So we were fortunate that we got to work with Ericsson, Singtel, and IMDA to put in the indoor 5G network in the hospital. So that system went live in November 2023. We've been using it for about a year and a half. We use it at least 2 or 3 times a week for the surgical side. And right now we are also using it to run our cloud robotics program, where we have autonomous robots in the hospital. And these robots, they are meant to be an assistant to the nurse. Right? So they are meant to go to the central pharmacy to collect medications and then bring it to the patient for discharge. They are meant to take vital signs from the patients at night when they're sleeping, and these are all contactless. And because of the 5G network, we can, in a way, design the robot such that it is what we call a 5G cloud robotics program. Right, so the brain for the robot is not on the device itself, it's actually on the cloud side. Right? And the connectivity is provided by 5G. But what goes beyond that is that because of the multi-compute capability and a software-defined network, we can then decide now what type of applications do we put on the edge, which applications do we put on the cloud, how do we rationalize that communication. And that has actually changed a lot of the thinking behind how do we onboard new systems, how does the new system fit in the whole ecosystem of the hospital, and how does 5G fit in the whole ecosystem for the hospital.
And hospital, and perhaps even beyond. We're thinking about ambulances, home care, and so forth. We went very quickly into the solution here, Gao, but you also explained a little bit how you are thinking around why are we doing this in the first place? What are the desired outcomes, and perhaps financial and non-financial metrics? Could you say something about that?
Yeah, I think the bottom line is that whatever new technology or new solutions we bring on board in the hospital, or even in healthcare in general, it has to have a benefit to the patient or to the healthcare practitioner. Right? So it starts off with a needs analysis, with a use case analysis, and identifying the gaps that exist within the healthcare system at the moment, and also potential gaps in the future, and how do we fill those gaps, either existing or predicted ones. Right? So finding that use case and finding that gap is very important, because if, let's say, we just take a technology in and we just use it, a lot of times that's when things don't progress beyond the pilot stage or the proof of concept. We show that it works, but there's no actual translatable benefits to anyone within the healthcare system, and that's where things stop. Right? So identifying the right use case and applying technology within that use case to show that it works and to show that the returns of investment, not just in the financial aspects, but the non-financial aspects. I think that's where the matrix of assessment becomes very important. Right? Because in healthcare, a lot of times it is difficult to put a number to an outcome. Right? So for example, even if let's say we put in the new 5G setup with the AR systems, based on the current results that we have, we are looking at sometimes up to 25-30% reduction in surgical time.
But that's a big advancement if you have 30% reduction.
That's right, correct. So that doesn't come back directly as a financial return, but it does come back as essentially time saved, anesthesia time saved for the patient, so lower risk from the anesthesia perspective. They go home faster. There's a lower risk of complications, and I think that's when a lot of the indirect returns of even from the financial perspective comes back in. But defining that initial matrix is very important, because if let's say we define right from the start that we're looking at financial ROIs, that it might be a bit difficult. But if let's say we look at ROIs from patient outcomes, and then from there, how does that translate into indirect financial ROIs and financial savings? I think that's where we should go.
But I think you've already proven the case, especially in the NUHS environment in Singapore. I know you're also looking to scale it to other hospitals.
Yes.
There is no reason why this solution cannot be sort of brought to other markets, other countries, whether for their hospitals or their healthcare system, or perhaps even for support in terms of education and remote help. I think you have good cases for that as well. Exactly. I know we are both super excited about the opportunities, not the least because it actually helps patients, it helps practitioners in the operating theater, and it's so relevant to be able to work together on also the next step. How can we improve this with advanced edge compute? How can we improve this with advanced data and AI processing? All of these things comes together on top of the 5G platform.
That's right.
So great. Thanks for the partnership,
Thank you, Erik.
and good luck with the next step.
Thank you very much.
Thank you.
Thank you.
Thank you.
Thanks.